Hello, my name is Dr. Sandra Finestone. I'm the Executive Director of Hope Wellness Center, and I'm here today to talk to you about sexuality, intimacy, and cancer. I hope that by the time this presentation is over, you will have a basic understanding of sexual health and how it can change after a diagnosis. Also understand what treatment options are available to help women regain their sexual health, and understand the psychosocial or emotional issues that arise as you are undergoing or recovering from cancer. I hope you'll learn ways to improve your sexual function, learn to reestablish a sexual relationship with your partner. When you're first diagnosed, it's doubtful that sex life is a top priority. But when you're further along in your treatment, issues of intimacy and sex often become more important. We will explore some of the more common physical and emotional issues and offer some ideas on what you can do to resume and maintain a healthy sexual life. First of all, let's look at what is normal after cancer treatment. Most people are relieved when the demands of treatment end. Many expect life to return to the way it was before the diagnosis, but unfortunately, this rarely happens. The time after treatment is a time of change of schedule, change of expectations, change in how your body's ability to respond to stimuli, change in relationships around you. Often, change in how you eat, what you do, what you have in your life, and sometimes who you have in your life. Although treatment is ended, you may still be coping with how it affects your body. It takes time to get over the effects of treatment, and each person's schedule is different. It takes time to reacquaint yourself with your body and learn what is normal for you now, so you will be able to identify any future changes that may take place. What are some of the common effects of treatment? You may have experienced some or all of these: fatigue, pain, lymphedema or swelling, problems with your mouth or perhaps teeth, problems with weight and eating, loss of bladder or bowel control, some menopausal symptoms that may be experiencing that you haven't experienced before, and sometimes changes in sexuality and in intimacy. The prevalence of this problem is very high. The American Cancer Society estimates that approximately 90% of cancer survivors experience some alteration in their sexuality. And age is also a big factor. Many cancers are hormone-driven. If you are premenopausal when you were diagnosed, you had a lot of circulating estrogen in your body because your ovaries were still producing that estrogen. Your health care team may have suggested that you have your ovaries removed, or at the very least, take medications to shut them down, or to give you medications to block the circulating estrogens from getting into your cells. If you are postmenopausal at the time of diagnosis, while your ovaries are no longer producing estrogen, your adrenal glands still do. Your healthcare team may have given you some medication to stop the adrenal glands from producing estrogen. These are called aromatase inhibitors. If you've been taking hormone therapy for breast cancer, does the exact opposite of hormone replacement therapy. While hormone replacement therapy adds estrogen to your system to try and bring it up to premenopausal levels, hormone therapy after a diagnosis reduces estrogen levels in your system and could cause some menopausal symptoms. It's very important to take the medications that have been prescribed to you. Many can reduce the recurrence of breast cancer, for instance. Reduced estrogen levels, however, can cause effects such as weight gain, changes in skin and hair, vaginal dryness, perhaps pain during intercourse. It can reduce the ability to have an orgasm for some women, and for many women, it reduces the desire to have sex at all. Changes due to surgery can also be impactful. Cancer surgery is a removal of the tumor and some of the surrounding tissue. So, for some women, scars are small and undetectable, but some are very prevalent and can cause a woman to be uncomfortable about her appearance. Radiation can also affect your skin and the contour of your breast. For instance, if you had breast cancer, it can change skin coloring as well as make the nipple very sore and uncomfortable. Breast surgery is called mastectomy, which is the removal of one breast, or bilateral mastectomy, which is the removal of both breasts. Today, skin-sparing mastectomies are very common, and this particular surgery removes the underlying breast tissue, nipple, and areola, but maintains the envelope of the breast skin. There is also a surgery called nipple-sparing mastectomy. It removes the underlying breast tissue, but can maintain the nipple and areola sections of the breast. Women may lose most, if not all, the sexual sensitivity in their breasts after any of these surgeries. Immediate reconstruction is very common today, but women need to be aware that a reconstructed breast does not have the same sensitivity that a normal breast would have. They should also be aware that if they have one normal breast and one reconstructed breast, these breasts will feel different in shape and feel. And women need to understand that if their nipples are saved during surgery with the nipple-sparing mastectomies, that they will not have the same sensuality that they did before the surgery was completed. Fatigue is a big part of the cancer journey. But fatigue is really misnamed. It's not that you're tired, it's rather you're weak from the surgery and treatments. So while you don't feel like it, the more you do, the less fatigued and stronger you will feel. Sex, however, for many couples is fast and furious. This may be a better time for you and your partner to explore quieter times of intimacy. It could be the time that you haven't had before to explore each other's body and find places where each of you like to be held and touched. For vaginal dryness, or atrophy, there are many products out there that can help. Some women even use olive oil. We suggest, however, that you do not use a vaginal lubricant that contains perfumes or flavors, as they could irritate the sensitive vaginal mucosa. For vaginal dryness and atrophy, there are many products out there that you can use. Some women even use olive oil. Do not use vaginal lubricants that contain perfumes or flavors, as they may irritate the sensitive vaginal mucosa. I would suggest, however, that you keep lubricants on hand so that when intercourse is spontaneous, that you will have something to help you along. You might try Arouse, or a KY Intense or Dream Cream if arousal or sexual desire is a problem for you. Hot flashes are a problem during these menopausal symptoms. Be aware of the triggers. For many women, spicy foods or alcohol create a hot flash. For some, acupuncture has been helpful. Antihypertensive medications can also be something that can help with hot flashes. Antidepressants have shown to be helpful for many. Even the clothing that you wear, cotton clothing, helps. Overhead fans can help for sleeping and to help with the hot flashes. And for some, controlled breathing, deep breaths through your nose seem to help. With regard to relationships issues, the diagnosis of cancer can pull strong, loving couples together, or unfortunately, it can tear them apart. It can destroy their intimate bond, or perhaps offer the opportunity to rekindle a previously fading fire. One of the most important predictors of sexual vitality after cancer is what was your sexual vitality before cancer. Couples who are able to handle life stressors before are typically able to adjust their sexual style to accommodate changes because of the cancer or because of cancer treatment. But even if a woman's sexual life before was not optimal, she is not destined for failure. This could be the opportunity to make some changes, to maintain or discover a sense of sexual self-esteem that you didn't have before. Unfortunately, many couples fall into a pattern of sexual activity that is not satisfying to one or even both partners. A cancer diagnosis may offer you the opportunity or the catalyst that allows discussion and experimentation to take place. Take advantage of it. When you're bald and nauseated, sensuality and sexuality may not be important, but intimacy can be vital. You may need reassurance about your desirability. If you're not feeling sexy, ask for that reassurance. If you did not feel sexy before, this may be the time to develop good sexual self-esteem. Men and women often confuse lust with love. They confuse sensuality with the sex act, sexuality with appeal, and intimacy with sexuality. Take some time to explore your notions about love, sex, and intimacy with and without your partner. If you have that discussion, you may be surprised at how differing or perhaps how similar your perspectives are. Let this be an exercise in communication. It may bring you closer to your own sexual self and to that of your partner. Make a date to have sex so that you can think about it all week. Remember when you were dating? You were thinking about that date on Saturday and you started thinking about it on Monday. You thought about what you would wear, where you would go, how the conversations would go, how intimate you would be during the date, and how intimate you were thinking you would be after. When planning for this sexual encounter, wear something that makes you feel sexy. This is not the time to wear that comfortable flannel nightgown. This is the time to wear something sensual that when it moves on your skin, it helps you feel feminine and enhances your feelings about sexuality and the intimate desire. Use lotions and creams to feel feminine. And importantly, do not wait too long before you become intimate again. The longer you wait, the more difficult it is. Take time to prepare for sex, as I mentioned before, with lubricants, moisturizers, creams, and if you haven't used them before, this may be the time to use some arousal aids. Let it be both an adventure for you and your partner, and let it be a journey. I would suggest you use the bedroom for sex and sleeping only. This is not the place to have television. It interferes with sex, and it very often interferes with sleeping. And don't assume that sex always has to end in intercourse. Sometimes just being playful is all that you need. Bring romance back into the bedroom. Read a romance novel and think about your partner sweeping you off your feet. Or try reading a book like 50 Shades of Grey if you've never tried a book like that before. Watch a romantic movie either with yourself or your partner. Watch a risque movie either with yourself or perhaps watch it together. Don't assume that intimacy always has to end with intercourse. It does not. Take some time to be playful, as I mentioned before. Explore new methods of pleasuring yourself. Explore new methods of pleasuring your partner. Find out what feels good for you. Find out what feels good for him or her. Communicate. Experiment. Communicate. And most of all, please, please have fun. Expectations about what life should have been or could have been can keep us from having a better one. Don't get stuck in that spot. Assumptions also can get us into trouble. If you're not feeling desirable, do not assume that your partner does not feel that you are desirable as well. This is a conversation that needs to take place. Clarify for yourself what you want. Clarify for your partner what he or she wants. Let others know what it is you want, and listen to what it is that your partner wants. The more you celebrate, the more you praise and celebrate your life, the more there is to celebrate, according to Oprah Winfrey, a very wise woman indeed. And remember that you are unique. It's important that you know and understand that no two people are alike. The changes from treatment that you experience may be different than someone else with the same cancer and same treatment. If you've talked about your treatment and your cancer journey with others, do not assume that yours will be the same. This is not a right way or a wrong way to travel this road. This is your way. This is your journey. Do it your way. And please try and enjoy both the journey and the road there. Joseph Campbell said, "We must be willing to get rid of the life we've planned so as to have the life that's waiting for us." Once your treatment is over, there could be an amazing life waiting for you. Please look at those opportunities to enjoy it. I hope you've enjoyed what I've had to share with you today. I hope you'll take advantage of some of my suggestions. I hope that you find some of your own ways to bring your sexual health back to its full and wonderful capability.